I have one area of inquiry where we're looking at essentially muscle function and muscle performance in athletic environment. And so what we're trying to do is identify if there are certain interventions, whether it be through the use of therapeutic modalities, stretching, things that we can actually use as an intervention to increase both muscle length but also muscle function. Those two go hand in hand, obviously. And what we're looking at doing is essentially increasing a person's performance, a person's muscle performance. In the athletic world, obviously that speaks volumes, because you can see that a person can gain a competitive edge if they're faster, or they can jump higher, or they can push somebody farther. And so from the athletic implications, that obviously this research is looking at finding ways to do it the most effective way possible. The other aspect to this research is that if you apply it and extend it out to the geriatric population, where slips, trips, and falls are prevalent and increase in the amount of hip fractures and injuries that can debilitate them for years, if not the rest of their lives, we can apply this same form of intervention and this same research to be able to prevent some of those, and potentially prevent some of those. And so we're really excited about how this could be extended out to both the athletic population as well as the geriatric population, and everyone in between. The other aspect of my research is respiratory pathology, and in this area we're looking specifically at exercise-induced bronchoconstriction, and what some people will refer to this commonly as exercise-induced asthma. This actually is just a phenomenon that occurs when a person overexerts themselves in cold, dry air and they feel like they're having an asthmatic attack. What our thinking is that we can actually train the skeletal muscles that surround the rib cage to be able to increase a person's ability to inhale and exhale through those perceived events. Again, the perception is that they feel like their windpipe and their lungs are closing down, and they're having what is referred to commonly as an asthmatic attack. What we're hoping to do is to retrain those muscles so that a person can actually exert themselves through that time period without having that perception of constriction. This research would be applied to the general population so that people will not necessarily be either misdiagnosed or even mistreating what they believe to be an asthmatic attack with pharmaceuticals or other medical interventions, when in essence we can actually use the skeletal muscles to train a person through those perceived events. And we're really excited about how this is going to impact not only the residents of Oklahoma, but potentially global residents and any individual that travels or any individual that is active.